That's why, honestly, I love having you guys on here because the patients generally know their bodies and what they're feeling and what they're going through better than anybody else. And I've seen this with my wife, who's a type 1 diabetic. We just know nowadays whether it's bad or it's like, oh, this isn't that bad, like which one we have to go with. And I literally, we have a bag packed now for the hospital for emergencies. We know, I go in and I just let them know the whole history time and time again. I know that when she's dehydrated, the veins are going to be hard to find anyway. You're going to need to get the
Mm,
machine out, because I promise you won't be able to find a vein, even if you're a really skilled phlebotomist. I'm nothing against your skill set. I'm just telling you what I've seen over the last 10, 15 years. Like, this is
mm,
just, we have no problem advocating for ourselves at this point, because we just
yeah.
know. And so it's something, you guys just make these like really tough and difficult things sound so simple. And I appreciate that, because it honestly, it makes a topic like cancer that is so deep and so heavy really seem manageable. Like, hey, we can do this. We can affect it. We can do some good here. Like, let's roll with this. Let's lean into it. So, thank you guys for all that you do. Like I said, I appreciate you guys, even just coming on and taking the time and giving little tidbits of your knowledge and all that you've learned over the years. We're going to turn it a little bit now to the educational side of things. This is your chance to kind of, let us know what's broken with the education system and how we can go about fixing it. But we ask all of our guests this one final question. And that question is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it? Alex, take it away.
Oh gosh, there's so much to unpack here. If I had to choose just one, I would choose two. I'm sorry, I gotta choose two.
Yeah,
One,
we'll
the
allow it.
cost is
Yeah,
insane. Even with, so I'm doing public service loan forgiveness, 16 months left,
nice.
but there's so many stipulations paying off those loans and getting them forgiven. I actually just found out, and the other people that I've talked to also did not know this, but whatever amount you have forgiven from your loans, that's actually taxable income.
Yep.
I didn't know this. None of my friends, like I talked to 10 different people, no one knew this. Elise, apparently you didn't know this either. That's a lot of money that is getting taxed.
Yeah.
So I
It's
think that's, I
it's
mean,
like
that's,
income added to that year.
it's, yep. Federal, yep. Government says, oh, this is taxable income for this year, which if, especially if you're towards the top of your tax bracket, that's pushing you into the next one. So I think just the cost of higher education is just it's astronomical. I think that's do I know how to fix that? Absolutely not. However, I know that that is a major issue that needs to be
I'm
addressed.
working on it. I'm working on
Right? Come
it.
on. But also how it's paid back, right? And I feel like even with scholarships, right? I feel like there's a lot that are available for undergrad, but then when you get to these doctoral programs, like there's maybe one or two per class, maybe. And so I think that's one thing. But second thing would be increasing the diversity within the classes themselves, but also with the faculty. We know that representation matters. We know that that matters in the education setting. We know that that matters in the healthcare setting. And when we don't have that, that's an issue. That's a major issue. In terms of fixing it, again, like I don't know, but I think that there's people doing really great work in this space, right? Lisa Van Hoos, there's Kai Kennedy, Monique. I mean, there's so many people doing amazing work in this. I think some of it, and this is what I was doing a little bit when I was in Maryland before I came down to Florida, was with APTA Maryland, like, and with some of the Centennial Scholars in the APTA program, working on pipelines. So working with and exposing to high school students, college students, what is physical therapy? Like, what is this magical profession that is so fantastic? So I think that if we can get better grassroots effort on these younger kids and younger educational levels, I think that that would be really helpful.
All right, two things real
Okay.
quick. One, cost is the number one most given answer. So if this was Family Feud, you'd get some points for that. But I will say one of our sponsors of the show, Varela Financial, if anybody has questions about student loan repayment, go check them out because they specifically work with DPTs.
Mm,
And I found out, luckily, early on in my student loan repayment, that if I just make the bare minimums on the new revised pay as you earn plan, I don't know what it's called
yep,
now, but there's a new plan. It
yep,
drops my payments down a ton, spreads them out over 20 years, but on that 20th year, I owe the tax on whatever's forgiven, whatever's left. So the whole plan now is to come up with an investment plan across those 20 years to have enough, more than enough,
yep,
to pay the tax bill when it comes. So
yep.
that's one thing. The second thing that you mentioned too is a major issue that's about to get worse because we have all these retirements coming up, right? All these amazing educators that are about to get ready to retire, right? It's just the circle of life. It is what it is, right? They're gone to bigger and better things, right? So then we also have all these new schools that are opening up, right? There's all every year there's a handful of new programs coming out. And it's like, okay, how are we going to staff all these if we barely have enough terminal degrees as it is? You're wanting to increase the amount of just terminal degrees available. And
Right.
then we have to also consider the diversity of people with the terminal degrees, right? So like CAPTI already has kind of muddied things for us a little with this 50-50 rule that 50% needs to
Yep.
be terminal degrees. Well, fine, if that's what you want, we need some sort of pathway or funnel to get
Mhm.
people from high school to now. Not even that many people are going to college because there's not a great ROI on it, then grad school, then more grad school. Like, it's insane. So like we've got to
Yep.
come up with some better solutions and bridge programs to get terminal degrees to anybody that's interested at this point in the world of physical therapy. So
Right. Yep.
thank you for bringing those up because I think those need to be talked about.
Mhm.
Definitely not easy. It's multifactorial as always, but fingers crossed we can kind of keep, fighting the good fight, and those a lot of those names that you mentioned, we'll keep up the good work, and we can just figure this out to some extent. At least we're not going to
Yeah.
completely get rid of this problem, but there's some pretty good ideas out there and we're working on it. So thank you for that. Adam, you're up.
Okay, so I'm going to attack most of the DPT programs out there. And one of the things that we need to fix is students and new grads, especially in this space working with cancer patients, need to be better communicators. They need to be
Mm.
better interviewers. They need to be comfortable having uncomfortable conversations. They need to be able to have difficult conversations, you know, with a manner of composure. I will share a very embarrassing moment that I had as a new grad working with cancer patients. We had a patient that was a young lady, early 20s, had people in and out of her hospital room all morning. She had just shaved her head the day before. And like an idiot, she's frustrated with the number of people that have been bugging her all morning. And I go in there and say, "Oh, I just a couple of things, and I'll get out of your hair." And just immediately just open mouth, insert foot, felt like a
Oh
jackass.
no.
Just so here's this young lady that you know just had to shave her head the day before, and now she's in tears because I said something that was, the intent was not to cause any harm, but that's how it was received by the patient. I've gotten a lot better over the last 8 years about having difficult conversations with patients. I have not made that mistake again, which I'm very proud of.
There you go.
But I think it's a hard space. We deal with patients that are going through these treatments and learn that they're not going to be able to get back to doing their favorite hobby, like something that was a large part of their identity. We deal with patients and family members and caregivers when patients are at end of life, and the number of conversations that I've had with patients that are my entire PT session is just like sitting and just like letting them reflect on their life. And I think one of the biggest things is, we as new grads and as students, we get kind of hung up on diagnoses, and we want to make sure that we are very technical with all of our hands-on skills and our interventions. And we kind of get lost that our patients are people. Like they have, you know, dreams, they have things that they still want to accomplish. They have fears about going through treatment and about what life after treatment looks like. And you know, we have our AYA patients that it's like, you know, am I going to be able to have a family? Am I going to be able to, you know, go back to school, to go back to work? Am I going to be able to continue? We have, you know, people that work in service industries where because they're so immunosuppressed, they might not be able to go back to the job that they had before. So we need to do a better job of, you know, being holistic care providers. That's kind of the whole profession. And when we look at things with such a narrow lens, like we miss the big picture that these are people. They are going through one of the most horrific things that they're going to go through in their life. Most of the time, they are very scared. They are unsure of, you know, what the future looks like, and we need to be able to provide really compassionate care. And if we can't, we're not going to build trust with these patients. One of the hardest things for me to do on a day-to-day basis when I go into a patient's room and they're, you know, 3 days into a cycle of chemo and they're in the hospital and they haven't seen their family in 3 days and they were up all night puking and the hospital food tastes like crap, and you know, there's this laundry list of things that they're frustrated about. And I now have to go in there and convince them to get up and work with me. And if I don't take the time to build that rapport, to build trust, to, you know, be vulnerable with patients, they're not going to trust me. We're not going to get anything done. It's going to make their path back to whatever their goals are. It's going to make it that much harder. So I think that's, you know, one of the biggest things that I would change is, you know, we need to teach these students, especially when we get students that, you know, come from very like heavily academic backgrounds. You know, we need more PTs that, you know, worked as, you know, waitresses and bartenders when they were in college and undergrad. You know, people that can talk to anybody about anything. Those are the people that we need to target.
Yeah, so a harder look at the softer skills, right? I was a caddy for many years,
Mm.
and that taught me a ton as far as communication goes and talking with different people, different ways. You know, there were definitely golfers that you wanted to not say a word to and just let them do their thing, and you had to kind of just gather that from their body language and, you know, how the round was going. And then there were others that just wanted to talk your ear off the whole time, and you had to be able to carry that conversation for 4 hours, you know? So industry taught me a ton. It was easily one of the best jobs of my life. So I attribute a lot of that to the service industry. So Elise, take it away.